Good evening. Welcome back to my Ask Me Anything. Every Monday night, 6 p.m. Central Time, I ask your questions about reducing your risk of having a heart attack or stroke. Also talk about some biohacking topics on occasion. So a lot of good questions today. A little housekeeping to start. So I finally got all the details for the Canyon Ranch event I'll be hosting in October. It's October 31st through November 2nd at the Tucson Canyon Ranch facility. If you've previously filled out a questionnaire for me, I did send an email this afternoon with further details about that. Once the people who have initially expressed interest, if they signed up, great. If not, if there's still openings, then I'll send out more details to people who are still interested. But if you still potentially want to come to that event, it's going to be a relatively small group, and it's just myself who will be attending with a few patients and hopefully some social media followers here. So if you want to come hike with me, if you want to potentially have some meals, do some Ask Me Anythings live and in person in Tucson in October, express your interest on my website, drtwyman.com/retreat. If you fill out the invitation application, I'll add you to that email list and send you information there. All right, so we'll jump into some questions and go from there. First question up tonight, is it safe to take creatine if you have coronary artery disease? The general answer is yes. Creatine is in red meat, so if you can eat red meat, no concerns for that. The only downside for some people on creatine is it can cause some GI upset if you're going over 5 grams a day, so start slow and work your way up. But a lot of benefits of creatine, and obviously it's having its moment in social media right now. Higher doses might be beneficial for brain health, but again, start very slow and work with somebody to make sure that you're on the right dose. Can the GLP lower inflammation? Yes. Can it decrease cholesterol? Not directly if you're at a healthy weight. So GLP is, from a vascular standpoint, more about helping endothelial function, so it helps with the arteries dilation. It doesn't really affect the lipoproteins. What about aspirin therapy to reduce LPA? So aspirin has been utilized is to reduce the risk of stroke or heart attack. It does not directly lower LPA. Patients with high levels of LPA will be at increased risk, potentially double of having a stroke. So aspirin is often recommended for those patients, as long as there's not a bleeding issue for them. How best to lower oxidative stress? It's multifactorial, but your job is to collect electrons. So collecting electrons through electron-dense foods, so seafood, particularly DHA, high electron load, grounding, so when you're outside barefoot, you absorb electrons through the surfaces of your feet, and sun exposure, light hitting your surfaces, charge separates the water in your body. So that's probably the best way to decrease oxidative stress. All right, so somebody's asking me about my opinion on cavernous angiomas in the brain. I have no experience with this and don't have any input on what may be driving this, unfortunately. You may want to look at Dr. Jack Cruz, who's a neurosurgeon, and this would be more in his wheelhouse. How effective is berberine at lowering ApoB? So berberine is a supplement that has a effect on the PCSK9 enzyme. That enzyme has an effect on decreasing the LDL receptors. The LDL receptors on the outside of your liver. They're like a docking station that grab the ApoB containing particles and bring them into the liver. Over time, those receptors degrade as PCSK9 it degrades them. So berberine prevents that enzyme from degrading the receptors, so the receptors stay out longer, clearing particles. How effective is it? As monotherapy, rarely. It may be beneficial to add on to other therapies, particularly if you're on some type of lipid-lowering therapy that affects cholesterol production, like red yeast rice, bergamot, Nexletol, or Statin. It may work well for those people. But generally, I wouldn't expect more than a 10 or 15% reduction in lipoproteins with berberine alone. Can calcifications in the widowmaker artery be reversed? So I don't particularly like the name widowmaker because any of your coronary arteries can contribute to a fatal cardiac event, but typically the widowmaker is the left anterior descending artery because that provides the oxygen nutrients to about 70% of the myocardium. Can the calcifications be reversed? Potentially, but that may not be the goal. The goal is to stabilize the soft plaque that has not yet calcified. So you want that soft plaque to delipidate, shrink, or become more fibrotic and calcified, but definitely I've seen CT coronary calcium scores improve in the LAD territory before. Is anything on the horizon that could replace the need for a pacemaker? Not to my knowledge. Your body's sinus node over time may degrade. So if you're becoming bradycardic, heart rate's under 60, exercise intolerance, unable to get your heart rate up with exercise, if you're passing out because of slow heart rates, an electronic pacemaker is really the only option. But this is not my area of expertise. I'm not an electrophysiologist. They're making smaller and smaller devices. There are devices now that are wireless, so they're getting better and better, but I don't foresee anything where there will be a non-implantable type of device for sinus node dysfunction, unless they perfect kind of gene editing. I don't know exactly what the question's implying, but how to protect the heart in 108 degrees Fahrenheit. I would assume you mean that's air temperature in a city. Staying hydrated would be key, but if you're in a sauna, oftentimes you're going up to 180 degrees Fahrenheit and you're going to be sweating profusely. So the temperature by itself isn't the concern. It's, what is the downstream effects for that temperature for you? That's a good question. Do I consider naps bad? No, I'd have them on occasion on the weekends if I have time. The only concern would be that does it affect your ability to fall asleep later that night? Two main things that help with sleep is your circadian rhythm. So that's going to be the light entering your eyes, the timing your nutrients come into your GI system, but also the adenosine pressure on sleep onset. So this is the reason why drinking caffeine too late in the day for some individuals really affects their ability to fall asleep. As you're making ATP throughout the day, the A stands for adenosine. The adenosine builds up. So as you're using your brain to make thoughts and activity, as you're doing physical exercise, you're building up more and more ATP, and adenosine breaks off. Eventually, when the adenosine pressure is high enough, you have sleep onset. So if you nap for too long, you may not be able to build up that sleep pressure to fall back to sleep easily. Generally, don't want to sleep with a nap over 90 minutes. You don't want to have a full sleep cycle. So, I don't have a magic number, but probably somewhere between a 20 and 45-minute nap is probably the longest you'd want to go. What is a silent heart attack? So there are individuals who can have myocardial infarctions and have no particular symptoms ahead of time. That is what you might mean a silent heart attack, that people had no warning until they start getting chest pain, pressure, tightness, and they had the heart attack. But there's other people, particularly diabetics, the nerves have been damaged by high blood sugar over time. They can't feel when one of the arteries becomes occluded, and the heart tissue will die, and they won't be aware of it until they either get an EKG or they have an echocardiogram and there's a wall motion abnormality. So that's one of the reasons EKGs are done, is to look for people who've had silent heart attacks. It is not always present in people who've had silent heart attacks. The echo would be more sensitive if you have a wall motion abnormality, but that's why it's a test don't guess philosophy. You have to go looking for things, because just looking at somebody's outside doesn't mean that they're necessarily healthy on the inside. So somebody says they just bought the Connect UT with the discount code. Great, outstanding. I have had the device for a couple months. It's very well calibrated compared to the Accor device I have in my office. I don't have any affiliation with the company other than they did send me a unit to play around with for the office and a demo for patients. So if you use that link, I don't make any commissions or anything like that. So how often do I test? My blood pressure is really excellent. So I maybe check once or twice a week with that device. But when I do it, it's first thing in the morning, feet on the ground, back supported, heart at heart level, and we'll do one measurement at that time. So first thing in the morning for most people, but if you have a history of hypertension, you may want to do some afternoon and evening ones to see if you have any circadian disruption of your blood pressure and you're having blood pressure increasing more in the afternoon than you would expect. What would be a solid heart rate recovery at 1 minute with exercise in your 50s? So when you exercise, if you stop, the heart rate should drop at least 12 beats a minute in the first minute to be considered normal. But higher degrees of drops, the more cardiovascular fit you generally are, the higher your vagal tone will be. I don't know what an exact optimal number would be, but mine generally drops well over 30 beats a minute after the first minute. So it's going to depend a little bit on how well conditioned you are to begin with, and what kind of volume of exercise you did, how much sleep you had the night before. But the device that I like to look for this is I use the Morpheus HRV device first thing in the morning, and that gives me my training zones. So I usually don't have much issue with poor heart rate recovery because I don't push myself past the heart rate zones that are predicted for me. All right, so now looking for the questions in the comments. So somebody says the code for the Connect device, if you go to the website, the code is just Apollo, my practice name, APOLLO, and that should get you $70 off the Connect QT device. All right, so this is a question I can't truly answer because I don't know more of the details, but what is my opinion of the left ventricular assist device? It's been 6 years since I've rounded in a hospital, so I don't know what the newest models are looking like, but they are oftentimes either a bridge to transplant or a destination device for people who have cardiomyopathies. Generally, the cardiomyopathies are due to ischemia. They've had heart attacks, and the heart is too weak to pump on its own, and they've already been maximized on whatever oral medications they can, but they're still often showing up in the hospital with heart failure exacerbations. The LVAD device may be offered to help in that situation by unloading the left ventricle. There's always a risk of clotting in these devices, so often you have to be on particular doses of anticoagulation, and there's always a risk of infection in these devices. So definitely need to be working with a center that implants a lot of these. Often those are going to be heart transplant centers, but there are some hospitals that in the community that are centers of excellence, have heart failure programs and have surgeons who are well versed in placing these devices and managing them afterwards. I do not have any patients in my current practice with an LVAD. Somebody says that they had a 3-vessel CABG a year ago, EF's down to 28%. Can that improve? Potentially. One, we got to get to the root cause of why you have such severe coronary artery disease. But in part, the ejection fraction may be low because you may have mitochondrial dysfunction, so you have to improve the redox potential of the mitochondria. There are certain protocols that may help with that. If you're potentially interested, you may want to check out my website, drtwyman.com, and click the application. What devices that I use to check in the morning or after exercise? So in the morning time, it's often the Morpheus chest strap. Morpheus, like the guy from the Matrix, the god of sleep. And then during exercise, I usually use the Frontier X2 strap for heart rate monitoring. So how do you improve redox potential? Is one, remove the things that are damaging it. But again, it was back to the question, is collecting more electrons than you lose to your environment. So grounding is extremely important. Seafood to get the DHA, sun exposure, those are the big ones. Sleeping well, that is the key to repairing the mitochondrial engine. So autophagy and apoptosis occur while you sleep. All right, so I think I got through the questions. If any others pop up, I'll answer them. But to the top of the hour question was that the retreat at the Canyon Ranch is now finalized. It will be October the 31st and November 2nd. If you're interested in going, a couple of days before or after, you can do that as well. And I do have a negotiated discount rate for that. I'll be there. If you're interested in potentially hiking with me, doing some AMAs live, maybe doing some poolside chats, if you were interested in kind of seeing what I do for relaxation or to optimize my kind of light water magnetism or my exercise, stress management, sleep, all the things that are topics I talk about here, come out and hang out with me in Tucson in October. So my website, drtwyman.com/retreat. There's a sign-up link just for information. I can send you an email if you want more details about the booking the event. So I hope you guys have a great evening. I'll be back here again Monday, 6 p.m. Central Time.